All right, guys, I want to talk to y'all about the CDC report that came out about COVID-19 earlier today. I've been seeing a lot of stuff on the internet saying that only 6% of the actual COVID deaths were from COVID. And I just want to explain that a little bit better and put that into perspective, because you have two groups of camps. You have one group of people that are saying, hey, this is a hoax, we got played, this is all a bunch of bullshit, X, Y, Z, and whatever, right? And then another group of people that are saying, oh, Trump manipulated the data, this is really serious, wear your mask indoors, and they're not going to change anything. So I really just want to offer up like a realistic perspective on what this means, okay? So what they meant when they changed the data around, or when they updated the data, it wasn't that only 6% of people who died from COVID. What it means is that 94% of the people who died from this virus had other comorbidities. It doesn't mean that, you got hit by a car and they just listed a COVID death. It just means that, you had like diabetes, or you had heart failure, you had some kind of illness or ailment attached to you, and then having COVID combined with that is what caused you to have really bad symptoms and ultimately die from it. So the whole perspective about this is that, this is a highly contagious virus, and this virus is going to be there with us probably for a long time, but it's not the end of the world. And here's why. Because only 6% of the people who died from this actually had COVID. And that means that the majority of people who get this virus, if you are healthy, are going to be okay. And they probably won't even have to go to the hospital for it. So what we need to be doing is we need to be encouraging people to lead a healthier lifestyle. Instead of our mayors telling us, hey, wear a mask, social distance, don't go see your family, don't go to the bar, don't go to the park, don't do X, Y, Z. We need to prioritize health and fitness a lot more than we are doing so. I would love to see our mayors and city council officials and our state representatives and our state governors start tweeting and retweeting fitness professionals and nutritionists. I would like to see us teaming up and working together with our sustainable farms here in Austin. I would like to see our parks get open so that people can get exposed to vitamin D and get outside and be able to exercise. I would like people to understand that gyms are essential and they're not super spreaders, and that being able to exercise and work out and go to a gym is actually, yeah, it may spread the virus because you're around a bunch of people and you're sweating, but if you're going to the gym consistently, the people that are in that environment are going to most likely be asymptomatic or have really mild symptoms anyway, so you actually are saving lives by telling people to exercise. You're lowering the hospital capacity by telling people to exercise. So that's the moral of the story, and that's the perspective that I want to generate to you guys. I'm Alex Stranger. I'm running for city council in District 2 in Austin. We need accountability in terms of how we listen to our government officials, and you owe it to the people that you're going to serve and just the people in general to tell the truth about what's happening, and that's what I hope to do. Thank y'all.